doing Masters in Bioinformatics and graduated from BSc Honors in Biomedical from University of Wolverhampton. I submitted my article to IJSR a couple of years back on identifying and examining different causes of liver disease in Sri Lanka under the article number ART 0017872. So let's go straight into this article. So why did I focus on this article? So liver disease is one of the major threats in Sri Lanka where it causes a lot of deaths currently. Where in most countries, most part of the countries, people are affected by liver cirrhosis, NAFLD and AFLD. So my study focused on identifying the different causes of liver disease and what is the most prevalent type. So normally people divide liver disease in two types: chronic or acute liver disease. It's depending on the duration of the liver disease in the patient and how long it's been affected. The disease categorized. So Sri Lanka records the second highest rate of deaths due to liver cirrhosis caused by AFDL or alcohol disease. This is normally released a lot of research articles. The project aim is identifying just identify different causes which was able to identify, and then it is one of the relevant topics to current scenario as kidney disease and liver disease are on the rise, and researchers carried out around the world trying to identify to disease in Sri Lanka. So we talk about the society's benefits. So when you compare to, so the society is benefited by this project due to many reasons. So one of the thing is identifying the common type of liver disease and how to control it. So that is the main idea of this. And second way is to identify and diagnose, early diagnosis, because AFDL and AFDL are two common types of liver disease which have no cure. They use normal medications to control the quality of life. So let's go to the next part. So these are literature reviews I use for my study. The main studies which I use, these are cited in my literature essay. So the method. So what I did is that I calculated out the statistical aberration from journals and data from WHO. So WHO official release data I used to identify different types of liver diseases, and these data are compiled and statistically identified to what is the most common type of liver disease. So then using alcohol factors and non-alcoholic factors we categorize, and based on that we were able to identify different liver diseases. So normally identify the normal types of liver disease. As you can see over here, alcohol-induced cirrhosis, which is most common. So the alcohol-induced cirrhosis in compared to females. Alcohol liver cirrhosis it's common in both populations, where there's an equal share of population, and in other forms there is is so much of female. The non-alcoholic fatty liver disease is caused by obesity. So alcohol is the most common type of cause of liver cirrhosis, where is only second due to alcoholic second number of deaths compared to Moldova. Moldova is the highest number of deaths per alcoholic liver cirrhosis. Sri Lanka comes in second. Another factor is high glucose, high blood glucose, another which causes. So in more females are liable to liver cirrhosis due to the high glucose level, which can cause. So dengue infection have been studies have been carried dengue-induced liver cirrhosis, which have to be identified as. So now using the results I identified, I collected data sets and identified that liver cirrhosis data from 1980 to 2010. So men are more affected due to alcoholic fatty liver disease, whereas NAFLD occurs mostly in males. Females are more liable to get disease. And that more prominent in Sri Lanka than and was being high. So disease type carcinoma do not have data sets. So this could relate. So means research increased case of NAFLD toxicity around the world with high glucose level, high sugar level as well. And due to liver cannot conduct a full study, so I was able to publish on IJSR preliminary studies for 30 years of data. So conclusion is that the number of increased liver disease causes a lot of deaths in patient causes. So this could lead to eventual problems as well, and it can lead to a lot of cases of kidney disease. So alcohol is one of the main factors, one of the main factors in Sri Lanka causing liver disease. And if you want to know more information about this, you can look at my article, which I come to a proper conclusion on the in-depth analysis. So these are my references I used as main sources. Thank you for hearing my presentation, providing me the opportunity.